Well, good evening, everyone, and welcome to the six-part series. And this is actually a bonus session on really the foundations of building a lifestyle medicine practice. And for those of you that have been with us for all six sessions, if you're just joining this as a part of a recording, Karol and I were just talking about, and I've been in this field for more than 20 years. This is one of the most valuable series in the nuts and bolts of putting together a lifestyle medicine practice. From designing your practice to the core elements of marketing, all the important part of reimbursement and the development of resources to work with your patients. This is a beautiful jumpstart program. So I hope you've enjoyed it. We've enjoyed having you here. This will always be available as a part of a recording, so you can go back and watch this again. Tonight is kind of a summary of putting it all together. And we have some exciting things that we'll share with you. And again, hopefully this will bring some of these pieces into context and show you through kind of an interconnected lens how all of this works together. So I'll turn it over to my co-host, Karol, to take us away. Welcome, Karol, and thanks again for all of your work, you and Deepa and the entire ProNex team for putting this together.
Thank you so much. I know we love having you here and behind the scenes, having Tom and Jill and Brooke and everyone making it happen. So kudos to you and your team as well. This has really been fun. So tonight we're putting it all together. We're going to talk a bit about the journey that we've had so far. We're going to talk a little bit about why there has never been a better time to be a lifestyle medicine practitioner. We're going to reintroduce Maya, Dr. Marcus, and Stella, and kind of guide you right through. And we're going to take everything you learned in the past 6 weeks, all the homework, and we're going to compartmentalize it into a ready, set, go model. And this is really a blueprint, so to speak, or a plan that you can follow to get your practice up and running, to actually grow your practice, to scale your practice if you've been practicing for quite some time. And we have all helped many practitioners. And I know I've worked so closely with so many, but having a blueprint, having a plan helps give you a bit of sanity. So we're going to kind of put it all together for you and then ask you where you are right now and answer questions that people may have as they're going along, things that they're coming up against and that sort of thing. And then a couple little surprises at the end. So we've gone through so much. I know you've seen this slide every single week. We've talked about your vision, designing your program, how to attract your ideal clients, new scalable revenue models that work particularly for lifestyle medicine, metrics so that you know what's working, what's not, and how to pivot, and then how to build that relationship with the patients, even though I know you're great at building relationships, but really to get your patients engaged in the beginning, engaged throughout, and get them to the outcome that they desire the most. And I'm going to let Dr. Stoll and Deepa, I really want you to dive into why there has never been a better time than now to be a lifestyle medicine practitioner, because it's so exciting right now. And I want to just make sure everyone, really gets this big picture. Okay. Oh, wait.
Yes, I'll start, and then I'll let Deepa take it from there. And just to provide some context, I started lifestyle medicine more than 20 years ago. I started when there were no conferences, when there were no resources. And as I've mentioned many times, I used to use my prescription pad to write breakfast, lunch, and dinner recipes and provide follow-up for my patients. And it's one of the ways that we developed that prescription pad from Plantrician project to assist people in understanding just some of the places to go. I've watched the evolution of lifestyle medicine from the early days of the ACLM. I was at one of the first conferences to now it's this incredible conference with board certifications happening around the world. And I believe that today is one of the most exciting times to actually start a practice in lifestyle medicine. When we look at what's available to you as practitioners today that was not available, there are an incredible host of resources at your fingertips that can help you from the design of your practice, with the implementation, as we talked about here with the reimbursement. There are lots of resources available. Some of the keys that I see today that are incredible opportunities for lifestyle medicine clinicians is the new reimbursement models, especially with Medicare reimbursement and group billing codes. This provides a true financial pathway for lifestyle medicine that did not exist before. When I was practicing lifestyle medicine, I was practicing as normal physician, billing my normal E&M codes and trying to fit it into my visits, oftentimes running over because there was no pathway to easily acquire reimbursement. And if I only saw a patient for nutritional counseling, I did not get paid for that visit. Today, that is different. And as Sumit in this program outlined in a really elegant presentation, there are many pathways to build a financially viable and lucrative practice in lifestyle medicine today. We have amazing opportunity to access a growing body of evidence that helps not only direct better care, but support the care that you're doing. There's education that goes on year-round through conferences, online activities. There's a community that's available. We have amazing community, the Plantrician Project and others, where you can meet with other practitioners, learn from them, learn what they're doing well, and adjust your practice. And there's incredible opportunities to understand how to market your practice, utilizing AI and other marketing tools to get your name out there and help the people that are looking for doctors to find you. So I just want to encourage you. I'm going to hand this over to Deepa now, but there is no better time to actually start a lifestyle medicine practice than right now. And this program and the tools developed, through this web series and through ProNex, not only assist you, but come alongside your patients in a meaningful way so that the implementation that happens between visits actually begins to take root and create sustainable, transformative pathways. Deepa, I'll turn it back to you.
Thank you so much, Scott, and agree with everything you just said, because my journey has also started 20 years ago with 2 CPT codes for dietitians, and I had to find those codes on my own. Even the billing person that I had contacted the first time, she said, we have never billed for dietitians. We don't even know what medical nutrition therapy is. So in that journey, I learned so much about billing and coding and reimbursement that I started believing that in order for to take the lifestyle medicine forward, it has to be there needs to be a scalable business model, and that has really helped me to not have that provider burnout. Even after 20 years, I get excited to see my patients, because from the very first day or very early on, I decided to invest in my education as it relates to lifestyle medicine. In fact, the funny thing is, until it was 2016 when I came to the first Plantrician conference, I didn't even know what I was practicing was even called as lifestyle medicine. I was sitting and somebody said, "Hey, it looks like you have been practicing." I said, "Oh, am I?" So that's how this field has evolved, and all along, the quest has been to figuring it out. How can we scale it? And organizations like Plantrician, ACLM, PPOT, they are doing a phenomenal job of educating us, bringing the science in front of public. But I think, as they say it in business, it's time to execute and scale and grow. And that's what that conversation on how to do it has led us to come together and offer this series, because, as you may know, over the last 6 weeks or so, we have touched upon from very basic case study, taking our characters of this story, Maya and Dr. Marcus, and most importantly, patient Stella, and understanding what do they need, what do they want, and the platform like Core, which is a lifestyle medicine delivery platform. It is not your regular EMR, EHR, which is being retrofitted to meet the needs of lifestyle medicine. I decided to collaborate with ProNex because all along I got the education, I got the support, but I didn't have the right tool to capture the data. So as we go through today's bonus session, we will touch upon everything again. And Karol, take over.
I'm actually going to ask you. Deepa was just mentioning ProNex and the fact that we have worked very diligently with Deepa. The developers have really taken her knowledge base, the knowledge base of many lifestyle medicine practitioners, and turned it into a beautiful platform that supports every aspect of your practice. So if you want to touch just a little bit, Deepa, on the unique aspects of the software, and then we'll get right into the ready, set, go.
Yes. See, interestingly, what has happened is the landscape and the players in weight loss or chronic disease space have evolved, especially with the incoming tsunami of GLP-1 medications, right? Even though we are in lifestyle medicine, we cannot just ignore what's happening in the marketplace. So the beautiful thing about the ProNex's core lifestyle medicine platform is that we were able to create lifestyle medicine focused functionalities that not only help the the providers from all different settings, but also support the GLP-1 functionalities. So what can I say? It is designed by someone who has practiced lifestyle medicine. And I have been using it for my almost. I have database of almost 7,000 patients over the years. So I'm currently practicing it, and it is so flexible to prescribe lifestyle medicine prescription. By the way, the prescription pad that I received at in 2016, stayed in my mind. So I give a lot of credit to Plantrician for planting that idea in my mind of prescribing 6 pillars of lifestyle medicine versus just handing out a handout.
Yeah. Beautiful. So anyhow, there's much more to learn about that, and you can always ask us about that. But Maya and Dr. Marcus, we're going to visit them one last time. We started with them back in week 1. And if you were a part of that, one of the things we really want practitioners to do, as we all should in our life, is to know exactly how do you want to design your practice? What do you want that to look like? And both of these practitioners will have successful practices. There's so many ways to apply lifestyle medicine into your practice. And yet they're both on very different journeys, depending on what it is that they want for themselves and what they want out of life and what they want for their patients and who they want to serve. So we're going to get into the many different settings, but Maya, a health coach, she's chosen a path of being more of an independent practice, a cash pay, potentially a little bit of hybrid, especially with the new coding and that. But her clinical why was, really that she wants that lifestyle medicine is the closest thing to the promise that she made when she became a health coach to her patients. And she wants flexibility with her schedule. She wants to work 3 days a week, have Fridays off, cash pay groups. And she set a goal for herself. We all have to have goals. So how many patients she wants by month 6, because it's not easy, as we all know. Either, we've all set up practices, we've all run practices, we all currently are in the trenches just like you. And so we have to set those goals, and then we have to work really hard to get there. Dr. Marcus, on the other hand, is like many practitioners I've worked with. Perhaps they're an obesity medicine specialist or someone who's in the bariatric surgery field, but anyhow, they want to add lifestyle medicine into their practice, or a primary care physician who wants to add that in. And so Dr. Marcus is taking that route. And so he is using lifestyle medicine because he knows that there are tools that are available through lifestyle medicine and the training and education that he receives through places like Plantrician that he never learned. And he can now apply that with his patients and help them truly improve their health. He's going to continue to work his same hours, but he wants to have a deeper impact. He's going to do some more group visits, maximize the use of that coding, and he's going to also do, of course, some one-on-ones. But he then sets a goal for himself about when he wants to implement this. So making sure that you have those goals set. But these are two very different paths. Both are attainable, though. Deepa, you want to talk a little bit about the different settings that we see people in?
Correct. So it's very obvious now that every branch of every branch of healthcare, and every setting where patients are being seen, lifestyle medicine is needed. I would say including ICU. As patients are recovering, we cannot underestimate the importance of lifestyle medicine, six pillars of lifestyle medicine, and 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 its impact on the recovery of patients' medical and psychological. I mean, basically overall health, right? So no matter which practice setting you are in, don't feel stuck. There is enough evidence now. You have opportunity to use that evidence and make a business case to make the lifestyle medicine and execute it. Okay, so, and that includes FQSCs, hospitals, individual practitioners, uh, mm, insurance companies, employee wellness. Literally, you take any model, any setting, and you will find, if you are creative enough, you will find a place to inject lifestyle medicine into that landscape. I have worked in private practice. I continue to work in private practice and community setting and FQSC. So I understand the nuances of both settings, but they are getting more and more cleaner now. It's not the struggle is not as bad as it used to be. The convincing to your authority or your colleagues, it's not that path is much smoother right now, because come on now, lifestyle medicine, food as medicine, sleep, stress. There's not a single person who is going to argue, oh my God, there's not enough evidence. Okay, so don't get stuck. It's time to turn your vision into a model.
Right. And that's totally what the first 2 weeks were about, right, Deepa? It was all about getting that vision and then turning it into a model. Now, will that model be something that is carved in stone? No, you can always be flexible. That's the joy of it. You can always be a little bit flexible, but you've got to have that vision and your model. So you can see here how we kind of brought that together into the two different pathways that Maya and Dr. Marcus have taken. So now that we've covered the first 2 weeks, we've kind of thought about what you want, turned it into a model. Step two really was positioning so that you have the correct people coming to you, those that you want to serve. Why do you want to serve them? Who do you want to serve? And how can you help them the most? So that really is another thing that falls into your whole marketing aspect of your practice, because you want to be speaking in all of your marketing tools, whether it's a blog that you're doing, a podcast that you're on, whether it is a podcast that you're running, whether it's your social media that you're putting out there, whether it's your research that you're doing, whatever, how you're communicating with those people you want to attract, you have to speak to those people specifically. So whether no matter what model you're in. So for Maya, she wants to work with motivated adults who are ready to change their relationship with food and their movement, and a support group sort of style. So she needs to build her messaging around that. For Dr. Marcus, he has his own patient panel. For him, his marketing is going to be a little bit easier. He has a patient database that he can promote this to, and so he has a built-in group of clients that already know, like, and trust him. Maya's still building that. That's why it's going to take her a little bit longer. We just have to count on that. Organic marketing, as fun as it is, and how easy it is with AI and many different tools, it does take a while for it to take hold. But I can assure you, I know in our practice here in Virginia, we have done so many podcasts and blogs, and we are like proliferative about our production of our content that I literally do no marketing. And we have so many, these assets, you can call them, are out there forever. So people can find them if you're answering the questions that they have. And I see this over and over. So does Deepa, and I'm sure Dr. Stoll does as well. If you build this, it takes a while, but it can build legs of its own. So we want to make sure that who you're serving and include that into your marketing. And And like I say, it's never been as easy as it is nowadays with AI, but we have to modify. If you've been around for a long time, like we've all been around in this in the field of weight loss and lifestyle medicine for over 20 years, it's so different. And so if you haven't watched the training that Deepa and I did about AI and how people are searching for you, I encourage you to do that. So this all, in terms of step two, is all about identifying who you're serving and making sure that you have that positioning correct. Uh,
Carol, I'm just quickly going to talk, just chirp in a little bit about
mhm,
the settings and identifying your target market and marketing from pretty much organically, right?
mhm,
Because you don't have to spend tons of time doing social media or hiring a marketing agency at this point.
Mhm.
Simple things like volunteering in the community, okay, can take 1 hour out of your life, and I cannot tell you how beneficial volunteering is. It's like a medicine for ourselves too, because you get to see like-minded people. So being creative about it. If you're already at an FQSC, um, at the one of the FQSCs where I continue to work on call, and I have been working for the last 20 years, is we started the Lifestyle Kitchen almost 12 years ago. Okay, and that became a gathering place for a lot of other organizations to come in and have their events. So, uh, so again, you can finding first 2 3 people or clients. That's where use your creativity, use your time, and then it's just going to start rolling.
yeah, you make it actually a very good point because even though I was mentioning all those things, we do see people so often spend so much time and energy on on their, their the things that aren't going to bring them patients necessarily right away. Their logo or they feel like they have to do video. I have to be on video. I have to do all these things. Your best, if you're just getting started, honestly, the best way to get patients is, as Deepa said, get a few of them to start with, but use your referral base. If you have an opportunity to speak at your place of worship, you do that. If you have an opportunity to speak with some of the other physicians in the community or other people, even in even if it's a health center, any place that you have access to that you can speak and you can provide them with content, or you can be the person who's on their platform, you will attract people in. Then you can start to have your first few patients and it will start to build from there. And you shouldn't try to do everything at once. You will overwhelm yourself and you will spin your wheels and you will get nowhere fast. So we do want to use your referrals. That's probably the best way initially to get going. But the other things down the road, as you move forward, they can be so exciting and add fuel to the fire. Dr. Stoll, did you have anything I can see you there. Did you have anything you wanted to contribute about that whole aspect?
No,
Oh, you're
mute.
on mute.
Thought you're on mute.
Mute.
Yeah.
Go ahead, Carol.
Oh, I was gonna say, did you have anything else that you wanted to add to that? Are you
No, I think you
good?
summarized it very well.
Okay. All right, awesome. So we're going to move on to set. We did ready, and now we're in set. And this part here is really related to what we addressed last week, and that's really as you're establishing your practice and your vision, you really do need to map out your patient's pathway so that you are crafting a pathway that is very understandable to them, that has one next step after another from the very intake all the way through to their long-term adherence so that they know the next step and they know what's included and how this is all gonna go. Because if you have a confused patient or someone who doesn't know the next step, they're gonna stop. They will end up not moving forward. Confusion creates an indecision, which creates lack of action. So Maya, in terms of this, she did initially she had some friction. She was giving people, was so zealous about all the education, a binder of homework on day one, and then but she saw that they were losing out on that. So her change, and you'll find these frictions as you design your pathway. You'll think, I have the perfect pathway. This is going to be awesome. And then as you implement it, you find, why are people falling off at this stage or this stage? And then what you do is that gives you the diagnosis or the problem, and then you go in and you diagnose what the problem is at that stage. So for her, She basically changed every visit now ends with an exact, clear next step for her groups. Not a full plan, not an overwhelming notebook to take home, and it's fully trackable. And you can do that easily through some software like ProNex. We happen to do that really well, but it's really important to make sure that you're able to track that. For Dr. Marcus, on the other hand, patients assume that a 15 follow-up would go ahead and uh, was the whole relationship. There was nothing beyond that. So he had to kind of rework those 15 minutes into setting expectations that this is a longer term relationship. This is going to take some time, and here's how we're going to get there together and provide them with that support. So as you build your pathway, you want to make sure that you've got that identified, then watch for these areas of friction so that you can address them and then move forward. The next aspect in terms of go is the third steps in our ready, set, go, and that's turning your impact into income. You have to have income in order to be viable, and the scalable revenue models that were covered back in week 4, I do encourage if you haven't watched that to go back and watch that. But you can use this a variety of frameworks, and we see this work in different practices. For Maya, her lever is delivery, not necessarily insurance billing. She's more of a cash pay model. So she's doing some group-based care. She's also doing some one-on-one visits. That's her scale. That's how she's going to scale her, she's going to serve more patients served per hour, and she's going to still build the same trust and outcomes. So she's going to do one-on-one and group, and she's going to have a cash pay. She may have a membership model. She may just have cash pay as you go. She'll have some additional revenue streams potentially in order to add to her revenue stream, but that's her lever. For Dr. Marcus, his lever is now with all the new codes is going to be stackable care management that Sumit addressed really, really well back in week 4. He's going to have some blended one-on-one visits, plus he's going to be doing the chronic care management and principal care management. He's going to do some combined billing and make sure that all the care that's being provided throughout that time with the patient is actually something that's going to be billable and something that he can get reimbursable by following the administrative recommendations that Sumit had as well to avoid denials and all of that coming down the pike afterwards. Deepa, did you have anything you wanted to add to the part?
Yeah, and the another model that is something to think about for those who have, who are hybrid or cash pay or insurance-based model is to work together. When I started, I didn't have a single collaborative practitioner around me. I went to nephrologist, cardiologist, primary care, family practitioner, even my fellow dietitians. Nobody was practicing or thinking about lifestyle medicine. They thought this is all voodoo. How can food be so powerful, right? So it was very frustrating not to have a team. Right now, if Dr. Marcus and Maya, who represent a lot of healthcare professionals, they can work together, and together they can build a very effective, scalable model in their community. And when your community, when your people around you, when they see that, you are going to get attention, and that's going to be really the stepping stone to scale and to add velocity to your income. So think about who are your collaborators and how you can combine the insurance cash pay hybrid model and work together, because as we all know, lifestyle medicine requires group effort. It's not take your pill and be done. It's not one and done type of intervention. So it's important that looking for right collaborators and putting that framework around your business model. Yeah.
Right. And I also think that it affects who you're just going to conferences. And, if you're going to Power of the Plate or a part of Plantrician, I mean, you get to meet so many practitioners and you can share ideas and you can share, and it kind of builds and you can come up with new ideas and then build new relationships that help you grow your practice as well. The next part of Go is knowing it's working. This is I know I get giddy about numbers, but
Yeah.
I do, but it's only because it's so important. So we did a whole series on the metrics that you should be monitoring from your financial perspective to your return on investment for marketing to your patient outcomes. We're really good about numbers for patient outcomes often, but the other ones we're kind of like, no, well, I'll worry about that when I have to worry about that. So for Maya, she's been focusing on marketing. What's her lead to conversion rate? She's still building her patient base, so she's looking to see how can I always be improving that marker. She's also, of course, looking at finances with a cash pay model and a membership mix. She has to look at what's her recurring revenue, what's her goal. So a lot of times we can do a revenue calculator. So we can get into the weeds with this, but it's really important to know what you need to be bringing in and exactly how you're going to be producing that revenue because you want to have smoother cash flow. It helps you do better, more things with your patients and help grow your practice. For Dr. Marcus, he's really focusing on the financial part. What's his net collection rate? What is his denied claims? Making sure that he's actually getting paid for what it is that he's billing. And he's also, of course, looking at his marketing. Now, for Dr. Marcus, he's been out in the field a bit, so he has a referral base set up, but he wants to look at who's referring, who are the client patients that are referring to me, who are the physicians or other practitioners referring to me. So it will vary in your practice, and you want to focus on what's your biggest pain point, develop your metric for that, and then dive in. And that will really make a huge difference to know where you are and to take a really smart step forward versus just feeling like you're throwing spaghetti at the wall. Um, and then Stella. Deepa loves talking about Stella. I do too. And this is what we're all here for, really. It's our patients. But Deepa, do you want to talk about Stella and how we've impacted her life?
Yeah, so I couldn't have been here without Stella's in my life, my patients in my life, because before the before my colleagues, my patients believed in me, and that's the beauty of lifestyle medicine, because you do get a chance to impact someone's life with such a simple intervention, without having any side effects. They get their vitality back, they get their energy back, they reverse their diabetes, they lose weight. It's unbelievable. um, Dr. Scott's new podcast is all about regenerative, health. So, and that fits beautifully. Why our job is to make sure that the Stella came to us with hope, and we gave her our best without overwhelming her. And that is possible only if we have our act together. If we have looked at our metrics, we expect Stella to measure her metrics and track her goals and have her system and get her process together. But then, as a provider, we have the same responsibility, and that is what this particular series has been, to become mindful about what does it take, what do we want, and what Stella need, and how to fill that gap without really getting overwhelmed, and having good quality of life or work life balance for us as well as for our patient Stella. So uh, one day at a time for Stella, clear next step per visit, tracking automatically, not have to count calories, micro, macro, something where she feels that this is doable. And that's what this is all about.
Yeah, I love that. This is just a slide that kind of pulls all that together. When you're getting ready, it's your vision and model. We've kind of talked about this quite some time. Set is your positioning, your journey, and then go is, of course, your revenue, gaining that revenue, getting everything in place, and then monitoring your metrics so that you can make tweaks along the way. But that's what this whole series, if you take all of this and put it together, it really does give you a blueprint that you can follow in order to be successful. So we want to turn it to you. Where are you right now? Which stage are you at? Are you ready, set, go? Looking back at the different things that we've covered, you know, what has been, where are you? And then what's the one thing that you feel that you're able to take away from this. And we'd love to open it up for questions if anyone has anything in the chat. Dr. Stoll's always so good about following through on that, but I was going to kind of turn it back over to Dr. Stoll and Deepa for any other comments or questions, and then see if there's any questions in the chat. And I do want to mention as well before we do that, that we are actually going to have a follow-up where I think I had, oh, we're actually going to have a follow-up. We're going to have office hours with us, and we don't want you to feel like we did all this and then it's kind of like you're on your own now, because we all need support. So Deepa and I are putting together an office hour, which will be once a month, and we can actually take questions. We can dive into what's going on in people's practices. We'll also have some additional speakers coming in. So there is more to come. We just don't want to end it right here, so you can watch your inbox for that. But in the meantime, I do want to open it up and see if there's any questions or anything else that we wanted to cover here tonight.
Thank you, Karol. And while we're waiting for questions in the chat, I just wanted to, again, just reinforce the value of this program and the value of the opportunity to meet with Karol and Deepa and the team. You know, coming out of medical school a number of years ago and starting a practice, and then realizing I wasn't prepared to actually start a practice and run a business, as none of us are unless we do an MBA in medical school, was incredibly challenging. And I learned a lot of things the hard way. I learned a lot along the way. But I think it's another challenge for us to try and create a lifestyle medicine practice. There are nuances and elements of a lifestyle medicine practice that are different and that take some specialty guidance. And again, that's the value of the 6-week program, especially the parts that we talked about that were, I think, some of the most open were the marketing and the reimbursement components. And those are incredibly valuable, but I think sometimes in lifestyle medicine, you know, we often miss that the resources that we give to patients that actually help them to make better decisions between visits is an incredibly valuable resource that can be difficult to create as a library inside of your practice. And so all of that is contained in this program. And, you know, I would encourage you, take advantage of those office hours with Karol and Deepa and the team to ask your questions and get some refinement and some guidance on how you can incorporate this into your practice. So I just want to, as we're kind of wrapping up too, I want to thank the entire ProNex team and Deepa and Karol for spending a significant amount of time organizing, you know, a very thorough, linear, and fluid presentation that brought together a lot of ideas into a way that was in small bites that we could consume and assimilate into our lives. So thank you for doing that. And thanks to our Plantrician staff for supporting on the backside too. So with that, Deepa, I'll turn it over to you.
We are here to make your lifestyle medicine dream into vision and want you guys to be successful, and really want to share our struggles and pitfalls and want to make sure that you don't have to you don't have to go through that, because we know that working on your own and this niche specialty can be sometimes challenging and sometimes frustrating, even if you are working with others who are not completely on board with you. But we want to give you hope that this is all possible. And we are not just this is not our hypothesis that this can be done. Scott works with an organization. I work within FQSC and in the community and in private practice. And I'm here to say that I'm enjoying and thriving. So there has to be some truth to this. However, this is not possible if you don't think through the process and set things up correctly from the get-go, and not go too far away and then look back at it and say, oh my God, I didn't have this, I didn't have that, but now I don't have time, I don't want to change again. That inertia to change can become your own obstacle. I say to Karol all the time, Karol, let's try something. If we fail, we fail, but at least we tried it and we learned from it. And let's try something different. Without risk, there are no possibilities. And I also feel that unless you are invested in a business, that can be any business or any setting, uh, you have to have your skin in the game. If you are just doing this as part time or as your side job, yeah, you will be you. It's not. I'm not saying that's bad, but if your ultimate goal is to grow and scale, then it's important that you start prioritizing what you want and how you are going to get there. And the software like ProNex's core lifestyle medicine platform is just one of that tool. And it's an important tool because I cannot tell you how much data I left on the table that could have been published, that I could have used for something else. And my goal in my life is to help more Stellas and Stella type families and patient population. So with all of us working at the same goal together, I know we are going to get there. So feel free to contact me and Karol. Stay in touch with us. We are going to bring in really interesting speakers about grant writing and fundraising, and we may bring back Sumit again. So we have lots of good stuff still coming your way.
Great, thank you. I see an interesting question here from Richard. Thank you for that question, Richard. And it's a really interesting question to look back historically on lifestyle medicine. And, we can trace lifestyle medicine back throughout history. There's an incredible thread that goes back to Socrates talking about the disciplined life, Hippocrates talking again about lifestyle medicine. And he made a comment that, examining the patient, you should always ask about the soil in which their food was grown. Then we go to Ayurvedic traditions in Asia, and a fundamental part of Ayurvedic traditions is lifestyle, food consumption, sleep, and rest. Chinese medicine talks about the foundation of Chinese medicine is the lifestyle, emotional state, sleep, calm, food. Galen, as I remember, was also talking about lifestyle medicine. And we can trace that throughout history where there's been this continuous lineage, all the way up into Florence Nightingale talking about lifestyle medicine. Then we had Harvey Kellogg, who is, founded the sanitariums. And the University of Cal Pomona has the Kellogg family house there, where they used to have a sanitarium to work on people's lifestyles. All the way up, and then we get into the modern era with Nathan Pritikin. So you're exactly right. There have always been a foundation of physicians and leaders in this area of lifestyle medicine who have continually promoted the idea that lifestyle is fundamental to human health. And with that, there are always patients that were connected to that as well. So I always like to believe that lifestyle medicine, whole food, plant-based nutrition, is an ancient concept, and we're just helping people to remember what has been important throughout the ages.
Absolutely. Because if lifestyle-based solutions are not, if they weren't around, how would the human race even survive, right? It's not like we were that there was no need for treatment plans. So diseases have been around. So 6 pillars of lifestyle medicine and plant-based nutrition is the core of human survival and not only surviving but thriving. I think with modern everything, we have hopefully have passed the stage of just surviving for the sake of surviving. I think we need to focus on thriving as human race.
Yeah, human flourishing. I couldn't agree more. So that's exactly right.
Yeah. All right. Well, I think that wraps up our series and our bonus session tonight. and we'll be in touch with all the replays for you, as well as a sneak peek at what's to come. So, Deepa, do you have anything else to add?
No, thank you all for joining and sending us emails and connecting with us. And cannot thank Dr. Scott and Tom and entire Plantrician community, my friends there, for all their support and just being open to have this series. That just shows the passion from Plantrician Group. And thanks again, and we will see you guys soon.
Thank you, everyone. Have a wonderful evening. We'll look forward to seeing you again soon. And thank you, Karol, Deepa, and ProNex team.
Sure. Thank you.
All right. Good night, everyone.
Bye.